All right. Hi, everybody. Welcome back to the podcast. I'm Dr. Lindsay Renzullo,
I'm Dr. Krista Vernaleken.
and welcome back to our first episode of 2021.
Oof. It's different. It's
It
automatically
is
different. It's
it is different. Well, I
2021.
have to
No,
say
it's not any different.
it's quite humorous because one of our producers, Rachel, sent me a small link of our first episode last January of
Yeah.
2020, and
Oh,
on it there was myself speaking about how I felt like 2020 was going to be a great year.
a great year.
And it was anything but. So my feeling of 2020 and what a great year was going to be sort of just fizzled. So a lot has happened, obviously, and we're hopeful for the 2021 to be a really good year. So, um,
Yeah, it's really fascinating seeing some of the, emails and things that we wrote down in terms of hospital plans and things like that just before the pandemic. We just had no idea how that was going to upend the veterinary world or the whole world. Like it,
yeah.
it just changed everything. So
Yeah. So it sort of segues into what our episode is today. We want to discuss, your visits right now in the climate of COVID in the emergency room in particular, just because we felt as though we are seeing, a lot of clients that sort of have concerns about how emergencies are handled because it's so different. And even though we're, months into this pandemic and sort of used to some of the new protocols, I feel like for a lot of pet owners, it's still a concerning time. It's a very emotional time with your pets when they're really, really sick and they're needing to go to the emergency room. And we would, like to give you a little bit of an inside scoop on what's going on when your
Mhm.
pet comes in through the emergency department.
Yeah, and I think, coming to the ER is a new experience for a lot of people because a lot of people have mostly engaged with just their regular veterinarian, right? That
Right.
they haven't maybe had those experiences, maybe they haven't had a pet before, or their vet had more availability to be able to see them there. So, coming to the ER, I mean, honestly, the first thing that I see somewhat frequently is actually, well, why are you guys still doing this curbside stuff? I can go to the store, I can go to CVS, I can go to my doctor or my dentist. Why can't I walk into your hospital?
Right.
So I don't know. Do you want to address that, Lindsay?
Yeah, I mean, the curbside service is a sort of phenomenon that's taken on in veterinary medicine, has been quite successful during the pandemic. And I think a lot of the reason is that, for some of our patients that need emergency care or even just general practice care or specialty care of any sort, the frequent flow of clients in and out of the hospital and then the client sort of sitting for a prolonged period of time in exam rooms just would increase the potential risk to our employees and our staff. And so, we realize that as a hospital, and especially as a 24-hour hospital, for where we both work, keeping our staff safe is so important. And if you get staff members sick, even if you get, one or two members on a particular shift sick, you really impact the overall ability of that hospital to function and still remain open. And so the curbside service has really limited that client contact that we have. And it does sort of impact sort of the overall visit, from the client's perspective, but from the veterinary perspective, we're still able to sort of provide all of the care and necessary things that we need for that
Mhm.
patient. It just may not be that you can't see all of that stuff being performed,
Right.
and that's where some of the perception can be changed a bit about how that visit goes.
Yeah, that's the thing is that if you really think about the way that you as a human engage with the world, we as veterinarians are one of the kind of few teams that can actually do the majority of our job without the presence of you as the owner, and that isn't something that's desirable. We would much prefer to have you in the room. There's plenty of times where we feel like our communication is not as great because we're that barrier of the telephone is there, and it's not how we want to do things, but we can without you there. So you can't go to a dentist and have your dental cleaning done without you being there, right? That's not an
Right.
option. That's why you can go to the dentist, because you can't have dental care without it. You can't you can theoretically avoid going into stores by using the curbside service that these stores
Right.
provide. There's a lot of different ways that you can avoid exposure to other people, but if we had people coming into this hospital continuously, we don't have a flow set up that could avoid contact between people. It just would be a potential nidus for infection for COVID. Not to mention, if we have 2 or 3 cases in the hospital, we're done.
Yeah.
We have to shut down, and we can't provide you that service. So, those are just kind of the reasons why it's still curbside, I think.
Yeah. And I think the personal protective equipment, we do have the ability of wearing cloth masks and, things of that nature, but we don't have, going to a dentist office. I don't know if you've been to a dentist office since
Yes.
this started, but they have an N95 mask on. They're wearing another mask on top of that. They're wearing a face shield too as well. So they have access to more advanced personal protective equipment, or I should say, better suited to deal with that type of virus. Whereas even though the cloth mask provides some protection for sure, they're not giving you that sort of security that some of the other things, the other masks can. And yeah, I think that telemedicine appointments, at least for human doctors, have increased too exponentially. So I think that human doctors realize that maybe not every visit you actually need to see them in the actual hospital setting, and so I think they're also trying to divert people where they can. And yes, those grocery delivery services, all that stuff has just really increased. For a while there, you couldn't even get an appointment to have your groceries delivered. So
No.
many people
Right.
were ordering online delivery. So understand that we do want you all back. It does make our lives a little bit easier, honestly, having you there. Having you in the room with us while we're examining them, pointing out little things, talking and discussing during the exam. But we are just trying to still remain open and be there for you when you do have an emergency, as opposed to us being shut down. And so, it's a protocol that we feel as though it is keeping us and keeping our staff as safe as we can. And we just, I know the fatigue is setting in, but trying to stay patient with all of us while we're trying to navigate through this is important. Um, yeah.
So you just got to the hospital, triage. So
Yeah.
triage is what we're going to do first. Triage is an old word back from the war. Um, but, logistically in veterinary practice, and especially in emergency, it's sorting. It's
Yeah.
sorting out patients by the degree of severity of the pet's illness. So it is basically trying to say, I want to see the pet that is of at most risk of dying or very severe complications if I don't see it first. And that is because in any scenario, you always have a limit on resources. And that's not to say that there's a limited number of people or a limited amount of room, but there sort of is, right? So if 10 people arrive at once, they're still going to have to be seen in some order. We're going to have to
Right.
make some decision. And if all of the patients were at the same exact degree of severity, if 10 ear infections showed up all at once, then they would just be seen in order of arrival. But if 2 ear infections show up, and then something that it was hit by a car and is going to die unless it's treated instantly shows up, that patient is going to be bumped ahead of the others. And I think
Right.
that's a pretty reasonable concept to understand, right, Lindsay?
I totally think it's reasonable. I think that in concept, when it's said like that, it makes sense. I think sometimes when clients are sitting in the cars now, because now we're at this
Mhm.
curbside service, the vantage point of all of our clients is a bit different. So
Mhm.
when you're sitting in that parking lot, you as the client are seeing patients, coming in and out and going in and out. And sometimes that extrapolates to, well, then my patient is, my pet is being skipped over.
Mhm.
Must not be, inappropriate in the right line. And often that's not the case by any means. It's just that, exactly like Krista said, is that, we've taken the patients that have come in through the emergency side only and have triaged them and separated them into order in which we're going to be actually seeing them and examining them. Often, a lot of emergency hospitals like ours have other departments that are seeing patients too as well for scheduled regular appointments. So, general practice appointments could be 20, 30 minutes long. And so you could, if you're sitting there for an hour and we have 5 general practice doctors seeing appointments, see tons of cases coming and
Right, you could
going.
see 15 client pets go in and out in the same time as you've been sitting there waiting.
Right. And you're
That's
like, well,
that's
what's going
right.
on? Like, I don't understand. And in reality, you showed up for an emergency, and whether it was a true, this pet's going to die unless some intervention is going to be made, or my pet has a skin infection and it needs to get treated today and it's important, but I'm in through the emergency room. And so in reality, the other patients that are actually in the hospital or in the ER right now, you don't really have necessarily the best gauge on it. So that can be understandably really frustrating. I mean, I think I would be frustrated if I was an owner and I didn't realize, oh, wait, all of those patients were like getting vaccines or they had scheduled appointments. That's why so many of them are coming in and out. Or those patients were ophthalmology patients only. They're only having their eyes examined by the specialist on an appointment only basis. I'm in through the ER, and so I'm sort of at mercy for the day of what's going to be presented at that particular moment. And even if the parking lot doesn't look super full, and you're like, well, it doesn't look really full, it's at nighttime. The cases that are already in there can be consuming too as well. So you could have some patients that, even though they've been in through the ER maybe an hour before yours, they still are not doing well, or they still need a doctor's attention, on that particular patient, monitoring them. There could be patients that are in the hospital that are already admitted that are not doing well and that they need some help, or a patient's in surgery and that's taking a doctor away from the floor seeing emergency cases because they're actually in surgery with a case that needed emergency surgery. So perception can be really, really hard, especially sitting in that car and not having, easy access to staff members to talk about what exactly might be going on. So we understand your frustrations. Trust us, we want to be able to see all of the patients as fast as we can and be able to make you feel involved, especially being out there. I know it's always a crazy time, whether or not it's a small emergency or a big emergency.
Back to
It
your
can be.
point on triage.
Yeah.
I just want to run a quick scenario by you. For example, triage, you were talking about how something more critical, obviously is going to be bumped up and seen quicker. Now, what about something middle of the road?
Yeah.
Yep.
But we're
It's
talking
always
about
the middle of
pain,
the road.
maybe,
Right.
so like how does your triage work for something in the middle of the road?
Yeah, I mean, the middle of the road is always the tricky part, right? So, how do I know whether this is one that something worse is going to happen if a delay happens or not? So, the easy ones are, like you said, like it's a trauma. It's bleeding proliferous. No,
Yeah.
I don't know
Profusely.
what the word is.
Profusely.
Profusely, that's the word. It's bleeding. It's gotten hit by a car. It has fractures. It's getting wheeled in. Those are obvious. And then the really stable ones are pretty obvious, right? It's like there's definitely no imminent danger here. Skin infection, ear infection, those are easy. The middle of the road ones are always the ones where, we have to make decisions. So how do we decide who goes first? Well, it's a lot of factors. So number one is the pet having something active that's going on that's causing that we could intervene and help it. Even if it's not going to go down the road of really getting much more critical, it's vomiting. So we don't want it to sit in the car with you vomiting just
Right.
an indeterminate amount of times. We don't want it to have diarrhea in the car with you or be just continuously spewing diarrhea if there is something that we can do to intervene. If we can intervene, for example, a toxicity. So an animal has eaten something and we actually, if we make it vomit, for example, soon, then we can avoid very severe complications. And if we don't, then we maybe still be able to treat it, but something worse is going to happen. So it's just, can we do something to intervene or, you know, I don't know, like could we foresee a potential problem that while it's not happening right at this moment, it could if we don't see one more quickly.
Yeah, and I
To
mean, going back to that triage, with those middle of the road ones, one of the things that's really nice too is that, the way in which a lot of these services are done at, various hospitals across the nation as well as our hospital is that when you come to Bulger, you call this number, right? And we'll have a technician that will basically take a assessment over the phone of exactly what's going on with your pet. And then figure out if this is something that you as the owner are really concerned about. Like, no, she's having trouble breathing. That's a no-brainer. We're right out of the car. We're taking that pet directly in right away and we're assessing that pet. We're getting vital signs on that pet. We're having a doctor look at that pet. And even though maybe they think it has trouble breathing, we bring it in, we do vitals, we say, oh, you know what? It's not trouble breathing. This dog was doing this weird thing called a reverse sneeze. It sounds awful, but
Sorry.
this pet's stable. they may say, we're going to put this pet over here and we'll definitely address those concerns the owner has. But as a doctor, doing my assessment, we feel like this pet's stable enough that can wait a little bit. So it's nice that we're able to get some of those vitals and some of those important numbers to sort of figure out, if everything is okay with the pet. So we do a triage not only with just by the verbal history that you're giving us, but then we will be able to do a quick assessment. And then from there, that's when sometimes you can wait. And that's the trouble sometimes where, you're thinking that maybe this is more of an urgent matter than what we can assess at that particular moment too.
And then, but before we move on to, I guess just addressing the referring community. So our hospitals are referring hospitals. So there's a lot of time where we have, general practice veterinarians in the area referring emergencies to us because it's something that they need different equipment that we have or specialists and so on. So how does that then rank? Do these people, so these people are transferred to our hospital. Do people have an expectation that they're seen quicker because they were referred? And how does that work? How do you deal with those?
Yeah, I mean, I think they do have that expectation, but really when they arrive at the hospital, it's really that same triage process. With the one caveat being that, for example, if someone is sent specifically for imaging, they're sent for an ultrasound, we'll try to we'll look at the case, we'll look at the situation, we'll look at the records. Hopefully the referring vet has called us to talk to us about the case in advance. So that sometimes can be something where, well, an ear doctor actually doesn't need to manage this case. It can go directly to that service or that person. And those sometimes will go quicker, but they won't always. And sometimes the referring vet hasn't called. They're busy too, that we don't have records. We're waiting for X, Y, and Z. And so then we'll have, okay, we don't know why this pet was referred, so we're just going to put it into the queue of emergencies, and it's going to be seen, in that same melange, that same order.
Yeah. And I mean, owners always have the ability too, that if they initially get that first triage history call of what's going on with their pet and things happen to change, like if they're waiting for an hour or an hour and a half before somebody's being able to get out there to get the pet, always feel empowered that you can call and let us know that things have changed. You know what? She's starting to throw up all over the place, or there's blood in her vomit and she seems weak. Please feel free to give us a call and let us know if the situation, the history has changed in which we need to be, more, maybe reassess how we're triaging that particular patient. It's a tough process because it's not always, people want to know exactly too, like wait times exactly, now that you've triaged my pet, okay, well, how long will it be right now? And that's tough in an emergency room because you don't know whatever is going to walk through that door or how situations or things can change. And so you have to sort of be flexible as far as, your expectations.
Mm-hmm.
Do you think that any of these kind of issues and stuff that we've seen have anything to do with COVID? That, the ERs are being affected by that in different ways?
Yeah, so there's a little bit of debate about what the real numbers are, but I recently saw an article from the Washington Post with real data on pet adoptions that suggested that, perhaps pet adoptions are up as much as 15% this year compared to last year. And that's just one number. I mean, that's rescue pet adoption. So that doesn't account for pets, purchased by at breeders or by other means. But that's something that if you say in 1 year, the total pet population might have increased by that much, 15%. Of course, some pets passed away, so that's not that total number. But, well, veterinarians did not increase their staffing nor their number of doctors. There's not 15% more vets in the world. That's a huge number of pets. And then you couple that with the fact that many of these owners are home with their pets and seeing things and having, honestly, a little bit more luxury of flexibility and time to be able to bring their pets in. So they don't wait for their referring vet. They just bring the pet into the emergency room for whatever the problem is. And that can be mild or severe. And then, pet adoptions maybe are up. So that may mean that routine vaccination appointments are up. Those appointments are booked weeks in advance sometimes. And so then the day of, you call because your pet has something going on, tore its nail or has an ear infection that you normally would have seen your vet for. They don't have any appointments available. that's the mantra across the board. Our
Right.
general practice doesn't have appointments available on the same day basis most of the time. We used to, but we just don't. So that drives the caseload is through the roof. Our caseload, I don't know, we have to look at the numbers again, but the most recent estimates were that our ER caseload had doubled. Doubled. We
Yeah.
don't have double the vets and technicians. We definitely have upstaffed, but you can't accommodate that much of a surge in that short of a period of time.
Yeah, and I mean, we do have a great relationship with a lot of the referring community. And, with that being said, because curbside service inherently takes a little bit longer, a lot of referring vets had to extend their appointment time blocks too, right? So normally when you book an appointment, you book it in a slot. You book it from, 2 to 2:30. That's your spot with your little fluffy pet that's going to go in that particular time period. Well, if curbside service extended it because we're going back and forth and calling on the phone and all this stuff, their appointments may be like 40 minutes long on average. And so that's just cutting back the number of appointments a lot of referral vets will actually have per day.
Mhm.
And that means that those things like Krista brought up, that come up on an emergent basis day to day, those vets can't see everything. And so they end up sending it to the emergency room. And so our emergency room never closes, but with the wait times will change based on that. So based on how many patients are showing up all at once, the wait times will vary significantly. So it's a struggle. I mean, the veterinary community definitely is one that has been busy all across the board. So the entire country has been feeling the increase in just overall case volume. And it's one of those things where, new protocols were adapted. Our hospital had a pretty pat down system of how we handle check-in, check-outs, how we handled every appointment. And it's just been totally uprooted. And now we're seeing more cases as well. And so, that just will inevitably lead to longer wait times at certain periods. Yeah.
Yeah. So, I mean, and then, so there's client arrived, calls, has that conversation with the technician. Technician decides, okay, I'm going to go out and get this pet. A lot of the time, that process is actually pretty quick, right? Like
Yes.
we're actually pretty good at collecting up the pets. We have space in the hospital to put them so they're ready, right? Now
Right.
your pet is in the hospital. You're in your car, or perhaps you're running an errand, or you went home, but you're accessible via telephone because that's
Right.
what we need. And now you're just waiting, and you're waiting. So why are you waiting? You're waiting because there are that doctor or doctors, at times we have 5 doctors on staff at once. They are seeing your pet. They're seeing the pet that came in half an hour before you. They're seeing the pet that came in 20 minutes after you, and the 3 pets that came in right after that. And they're doing their own triage too. So they're evaluating this pet, deciding what it's going to need, calling that client. Then they're directing their technicians to do what that pet needs. Then they're moving to the next pet. They're assessing that pet, calling, deciding what the plan is, and directing their technicians. Now, where are all these people? These people are running around trying to do all of this, right? And
Yeah.
there's a lot to do for each pet. So each pet is going to need at least to be examined, have their temperature taken, sometimes blood pressure, sometimes blood work, x-rays. I mean, that all takes time. And so that's why you may get a phone call and then wait a while, because people are actively doing work on your pet and other pets simultaneously
Right.
or sequentially. And there's not just unlimited, we don't just kind of go, okay, get this person to come here. Well, it's the same people doing the work on each individual pet.
Right.
Right.
And like you said, I think it's important to say that you mentioned it really briefly, but having multiple pets being worked on in multiple different departments by multiple different people. So it's not the entire hospital working on one pet at a time.
Right.
X-ray could be backed up with 3 cases, and you have the radiology team doing one at a time, doing whatever they need to do for the orders. And so it's not just one at a time. There's
Yeah, and
many.
we try not to just, rush these pets through too. I mean, the technicians are being so sweet talking to them before they're getting their blood work, trying to make them feel calm and comfortable. I mean, this is not a we don't want it to ever be a factory. You know, some of these patients need to be sedated before they have x-rays because it's a really scary room and that takes more time too. You know, everything we're trying to do with care and compassion for the pet and realize that, you know, we want to get them as back, you know, back to the owner as soon as we can, but it doesn't happen instantaneously by any means. And often doctors are juggling multiple cases all at once, just as in the human ER. I mean, if anybody's been to the human ER, you can definitely appreciate like how long wait times can be. I mean, they can vary significantly for sure. I've been in the ER wait time. I've been in the ER with my kid for like almost 16 hours when she had to get her fingers like sutured back on basically. And I thought as a mom that was this has to be first priority, right? I mean, her fingers are off and it wasn't. It just was, nope, she's going to get wrapped and we're going to wait all night until the crew that can actually do this will come on in the morning. And so, you know, it can be tough. The same thing that humans sort of face in that realm, we also face.
And I think that, you know, that you had said like the parking lot's empty, there's not a lot going on. I gotta assure everyone, we're not just sitting around, like seriously, let's
Here.
have a serious discussion here. We're not sitting around in the coffee room chatting.
No.
We're not like legit. The teams that are working their butts off right now. They are working so hard. So what I just need to assure people is that they're working hard. They're not sitting around. They're not eating bonbons, to use that
And when
phrase.
your pet's brought in, I mean, your pet's brought into the ER. I mean, we have all these wonderful cages in the ER itself where we can actually see the patients, right? We put them in there if they don't like to chew and eat their blankets. We put them in there with a nice blanket and, you know, we get them the things that we need. So we have the technicians not only helping us with all those cases, but taking care of those patients. So in case one, you know, has an accident in its cage, that we're there to clean up that accident too. So all that stuff, we're trying to take care of those patients as well in a good way, because we want your patients to have a good experience as well. I mean, I know you're the same way as me. I mean, I don't ever just take a dog and just like, all right, here, I'm going to start examining you right in your face. You know, I try to say hi and let them warm up to me and take that little bit of time to, you know, realize that this patient is nervous too as well. Now they're away from their owner, so I
A
want to
lot
make
like
them feel.
pediatrics.
Yeah, it's just like pediatrics,
Yeah.
right? Yeah. You have to make sure they feel comfortable. You're not going to just, you know, start drawing blood work and throwing them in an x-ray. So, you know, we really are trying to take care of everybody. So
And I
it's a
think
hard
one
time right now.
thing, a big thing we're hearing right now is the wait times on weekends. So
Yeah, I was just gonna mention.
weekends are the things we're hearing, you know, up to 6 hours or more wait time. So what does a weekend look like for you guys in the ER?
Yeah, weekends, the caseload is higher for those 2 days of the week, Saturday and Sunday, than it is for the entire rest of the week combined. So the weekend caseload goes way up. The weekend caseload goes up because veterinarians, although they're open on weekends, also would like to be off on weekends. So routine veterinarians, you know, your regular vet has hours on Saturdays, very likely. Some of them have hours on Sundays, but they're not going to be as long and they're not going to have as many people on staff on those days. And so they're going to be necessarily sending a lot more of their cases to us. So, you know, when they close at 4 p.m. on a Saturday, that's way earlier than they would have closed on a Tuesday. They're open later and they have just fewer appointments available on those days. Also, you're home with your pet even more. I mean, I suppose right now that's maybe not the case with a lot of people working from home, but traditionally, people are home with their pets on the weekends. The weekend is the day that they are going for a nice big hike in the woods and getting a stick stuck in their eye. The weekend is the day that the kids are home and accidentally leave the door open and the dog gets hit by a car. So the accidents happen when your pet is with you more so than when you leave your pet in its crate at home or leave it at daycare. I mean, I suppose accidents can happen at daycare too, but it's just true that when we're doing things with our pets, they're more likely to have injuries, or they're also more likely for you to notice that they're vomiting or having diarrhea, right?
Yeah. Definitely. Or you have free time that you're able to take them to the vet. I mean, maybe they've been
Right.
having those symptoms throughout the week, but you've had a crazy week at work. And so the weekend is the time that you're going to take them to the vet, but it is our busy time too, as well, for sure.
Now, what it's not is a time that we as an ER hospital have less staff. So that's actually some of the biggest staffing days that we have are Saturdays and Sundays. Just because of that, we know it's going to be super busy. So we you're not waiting longer because we don't have enough people. You're waiting longer because there's more cases on that day than on another day.
Yeah, for sure. Those are good
Um,
questions.
and then, there was one other question that, we'd seen a little bit of is like, well, what can I do to help? I'm the pet owner and I just want this to go super smoothly. And, there's probably in the end, a lot of it is luck of the draw of what's there when you're
Yeah.
there, right? But we do advocate that you call ahead at any ER hospital. If we know you're coming and we can just, look at the board and see what the day is going to be, it's a lot easier for us to say, okay, do this first, then this. It just keeps it organized, right?
Yep. Yeah,
Um,
definitely.
Waiting, Lindsay had said earlier, if you're sitting there in the car and you are waiting, it's not going to be helpful for anybody, honestly, in any walk of life. And same here, to start yelling at people and to get really frustrated. You can be frustrated for sure. We're not telling you how to feel, but directing that frustration to screaming at a staff member, which is happening somewhat frequently, isn't really going to help anything. In fact, it's just going to make that entire visit have an air of anger that really we don't need that, and we don't want that to be there for your pet's proper care. But if you're waiting a long time and you just want to know, hey, where am I in the line? Or,
Right.
has anything changed? That's fine. Keep a line of communication up. If your pet status does change and you are actually in the car with your pet and they start, like Lindsay said, vomiting with blood, or
Yeah.
something has
Give us
changed,
a
then you
call.
should let us know. Yeah.
Yeah.
When you have cases in the hospital, because we talked about how, there's multiple cases going on because there's multiple doctors, multiple technicians. If they're kind of in that middle of the road, but they're hanging out in the hospital, most of our hospitals have ICUs. So I guess what's kind of the scenario of a pet that's been inside for a while, so you don't really know, they're not getting full diagnostics yet, but are they in the ICU? Are they getting triaged repeatedly or TPR'd repeatedly?
Yeah,
Yeah.
I mean, we do
Go
have
ahead, Lindsay.
oh, go ahead. I was gonna say,
Sorry.
we do have, like, in the ER, there are cages that are visible to all the to all the, technicians and doctors that are working. So we're able to sort of see those pets, and we have an electronic medical record that's started on that pet when they are admitted into the hospital by the technician, meaning the technician takes that pet from the car into the hospital. They get sort of put onto our electronic board that they are now in the hospital. So we do still have tabs on them, and we are still watching them. As far as the initial triaging, once that's done and once that's performed and once a plan is made and then the owners are contacted, that's when they sort of get into the next, flow of, okay, this pet's going to need a bunch of diagnostics. Until that point, though, they are being monitored and watched. It's just that they're not going to be, next up to get those tests.
Yep.
Yeah, there's sort of an internal, I would say there's like an internal allocation system, and this is going to vary depending upon the hospital completely because it depends on the architecture of the place. At our hospital, a pet that is more critical is out on a table being addressed right at the moment. A pet that's, actively being worked on, and perhaps we might have concerns about the pet, but they're not really critical, is going to be out still in the main treatment area, perhaps, on a leash, tied to one of our ties, but kind of in the public view and being worked on. And then the pets that are truly completely stable are in a cage, still visible to everybody. But we're not going to force our temperatures on them regularly, right? It's mean. We don't want to be overly aggressive in their monitoring. So we don't necessarily retemp every dog every 20 minutes. That would cat.
And then once it's determined that they're like sick enough that we want to admit the patient to the ICU, we've talked that over with the owner. We've created a plan of how we're going to sort of handle it. That's when they get transferred into the ICU, where all the patients that are now classified as inpatients are staying within the hospital, which is a different section.
Yeah, and it's a little bit of a difference between human medicine. In human medicine, you feel the ICU is the really critical, the ones that might be on a ventilator, or really, really critical patients. In our hospital, we classify most of the hospitalized patients that require regular monitoring as they're in the ICU, because we really only you have the ICU and you have the wards. And so it's not like there's many tiers. We want to make sure that we allocate our staff properly. And so we don't want to have a bunch of little tiny rooms, and this is the really sick ones, and this is the medium sick ones, and this is slightly sick ones. So they just kind of all go into that room that we classify as the ICU.
Yeah.
Just for, I know we talked a lot about different cases, ear infections we listed, hit by cars, but I guess just for the listeners' pleasure, what are some of our like most common critical cases, and then most common like non-critical cases that we see? And is there a difference for season? Like, do we see a certain thing more in the summer versus winter?
Yeah. I mean, we see a whole gamut of things. I mean, we can see a variety of different cases through the ER on any given day. Some of our more serious patients are things that require medical or surgical intervention, or there's going to be an acute crisis. So the hit by car obviously is the big one that a lot of people, just think about inherently, because that comes in, it's normally pretty dramatic. But you can have anything from that to a condition known as a hemoabdomen, or sort of a bleed into the abdominal cavity, in which the patient has a tumor somewhere that's sort of bleeding and that's causing, a massive crisis in that pet. Any sort of acute respiratory distress case is always concerning. Sometimes we see seasonality in that, in the sense that a lot of older dogs develop a condition known as laryngeal paralysis, and it makes them have a hard time panning efficiently and really letting off a lot of excess heat. And they can go into a pretty severe acute respiratory crisis in like hot, humid months. We can see things with kitties that, have some sort of seasonality, where it's called a urinary obstruction, where they can't pee and their bladder basically is filling up, but they can't actually void that urine out. And those don't necessarily always look so concerning right away to the owner. They might just say, oh, they're peeing a lot in a litter box, they're going over, and like nothing really is coming out. And then they can slowly, pretty quickly decompensate as they can't get that urine out, and those toxins build up in their bloodstream. We get the run of good lacerations and bite wounds and fight stuff like that. Actually, I just had the other day a chicken that got lifted up by a hawk. The hawk came down to get the chicken, and I've never seen anything like this. All the skin flapped up over this chicken's head. So we were able to pull all that skin back and get it right back on that chicken. And that chicken's doing great. Oh, wow. The chicken's doing great. Yeah. But anyway, so you can see the whole run of the mill of all like lacerations and such. What about you?
From your standpoint, like as a client, a lot of the time it's like what you brought your pet in for, as opposed to like the definitive diagnosis as well, right? So like respiratory is a great example that Lindsay just gave. Like if your pet is having trouble breathing, it's going to get rushed in quicker. If your pet is collapsing or is so weak that it can't stand, right? That's like those hemoabdomens, the ones that are bleeding and they're severely anemic. Basically, those are always things that we have on our radar for that pet might be more critical. And then like something is actively like spurting blood from someplace. Those are actually, they're sort of both a very critical and not always a critical, because a lot of the time the owners feel really profound, this is really horrendous what's going on right now. But we bandage it and get the bleeding stopped, and now it needs to wait for its surgery to happen, right? So like that's often one of those ones where we'll get really upset, people that are like, he's going to bleed out. I'm like, I swear I'm not going to let him bleed. He's not bleeding anymore. We're going to do the surgery, I promise, but he's not actively bleeding. And that's our bad for not communicating those kinds of things as well as we could.
Yeah. Yeah. But the emergency room is a really like cool, interesting place because you can see the whole spectrum of cases that come
The
in.
chicken.
And yeah, the chicken, like that was a first for me. But no, I mean, I think that, the cases that present there always keep us on our toes. And from an owner standpoint, you're right. Like it's more stuff most often than just the symptoms of what's going on, and that we have to kind of come up with that definitive diagnosis. But because of that huge spectrum of cases that we see, that's tends to be why, and the inconsistency of when they come in, like the fact that at 2 p.m. we could have 15 things show up all at once, whereas if they came in 2 hours before, there was literally nothing on the board. It just is that inconsistency of when the patients actually show up, um, can just make the wait times a bit longer for everybody. And everybody nowadays, I feel like we are all a little bit COVID fatigued, and we're all pandemic fatigued. And I think that just waiting, in the emergency room is one less thing that we want to have to do. So we empathize with all the frustrations that people are feeling, but we ask for for patience too.
Well, and I'll issue a little public service announcement here as well, is that as the vaccine rollout has been progressing, many states have decided that veterinarians and their staff are classified in with the general public, not with essential employees or any other sort of healthcare workers that don't directly work with COVID patients. And that honestly, that's been a bit of a frustration for the veterinary community that
Yeah.
we've been working all through this pandemic. Many vets have donated supplies to human hospitals for their use. We don't have human contact necessitated by our patient care parts, but we do go into contact with the other staff members who we
Right.
don't always have control over their adherence to COVID protocols. And it's just the kind of thing that, vets are really kind of frustrated at this point. And so, if you as a pet owner want to do something in that regard and help us to be able to welcome you back into our hospitals, then it's to
Yeah.
get vets and their staff vaccinated as well and bump them up in the line. So that's something you can contact your, state departments of public health or, other officials to see, put in a good word for us. Most of our organizations are trying to advocate a little bit we don't want to be ahead of people that deserve it, for sure. We don't want to be ahead of really high risk people or people who are in contact with other, COVID patients, but
Right.
we kind of think that we should be in the same line as those who, man stores and other things like that, restaurants.
Definitely. Yeah, for sure. Yeah.
Mhm.
And hopefully, I mean, there's talk of maybe just opening up vaccination anyway to everybody,
Just
meaning,
everybody. Yep.
yeah, like they would get, so that would be another really awesome thing. If we could just get the vaccines out to the general public, it'd be great anyway.
Right.
Um, yeah.
I still am wondering how many listeners are mortified by your chicken story right now, Lindsay.
Oh my
Because that's
God,
what
it
I'm still
was.
thinking about.
I have to
Well, the
say
chicken
it
didn't get
was.
eaten by a hawk. Let's put it that way. It's alive.
It's alive and doing well, not just alive, doing great. So,
Chickens do
um,
great. Chickens
yeah,
are very
Yeah, I wish you
yeah,
saw my face when
yeah.
you
This
were
poor
talking.
chicken. That
weren't
poor
horrified
chicken.
by the daughter in the ER story. That was
What
fine.
happened?
That one too. Yeah, your
Oh
daughter with
yeah.
the finger. I'm like, geez. Oh, my
Oh,
Yeah.
my fingers.
fingers.
I know.
Lindsay's
Isn't that
really
awful
freaking
though?
out our
But see,
listeners.
that's the thing. I mean, I as a parent thought for sure she would get seen and like fixed right away, and it just didn't happen. And it unfortunately happened after I had worked an overnight, so I hadn't slept, and like by the time I got home, I hadn't slept in like 40 something hours. I was like delusional. But yeah, no, it was a rough go of it. But I think that perceptions too, what you think might be an emergency and needs to be taken care of right away. In reality, they were able to bandage her fingers and the bleeding had stopped, and then she just had to wait for the specialist in the morning.
Yeah.
Yeah.
Well, that's our show for today, I think. On that note.
We have some
So
fun this year, though. Our producers are doing an awesome job
yeah.
this year of really getting us some super cool stuff for the year and for our episodes. So we have great content coming up. Next month, we have a wildlife specialist that's out actually in California, which I think is going to be fascinating to talk to her because I want to hear what kind of wildlife they get to see out there too, if it's a little bit different than what we're sort of
Yeah.
taking care of on this side.
people have a good opportunity to ask all of our burning questions as veterinarians about wildlife rescue and rehab, which is always something that we run into as emergency vets when someone brings a little random creature to us and we're like, we're not licensed. So that'll be great to talk to her.
And
right?
if anyone has questions, ahead of time, you can send them to us through social media at, Bulger, Ethos. You can also email us.
Awesome.
All right. Well, so we'll say goodbye for today. I'm Krista Vernaleken.
I'm Lindsay Renzullo. Hope you can join us next time. Thanks to our sponsors, Ethos Veterinary Health. And you can catch us on anywhere you get your podcasts, on Google Play, your iTunes store, or anywhere else. So wherever you get those podcasts.
We don't really know where you get your podcasts.
We don't know. I actually have
Spotify, Audible, you can get it everywhere.
Audible. I just repeated her.
Thanks.
Excellent.
All
so
right.
Have a great day.
All right. Hopefully 2021 is going to be a little bit better.
Ooh,
We'll see you soon.
Bye.